Breaking news, New York Governor Hochul speaking right now about the surge of COVID.
Point on, while this may be highly transmissible, at least from the early evidence, and again, more information is still forthcoming, we want people to know that the early cases that have arisen are not life-threatening. They seem to be minor cases, and that is a source of good news for us right now. But in terms of the information we received, literally there are 5 cases identified today in the state of New York. The first one was in Suffolk County. I've been in communication with the county executive, Steve Ballone, to alert him. This came out of a lab that is in Suffolk, and it was a 67-year-old female who had symptoms, mild symptoms of a headache and a cough. There is some vaccination history. We don't know if it's 1 vaccination, 2, or a booster shot, and that information will be shared with the public as soon as we receive it, but there's at least 1 vaccination involved. This is an individual who traveled from South Africa, who tested negative upon returning to the U.S. on 11/25, and on November 30th, they took a point-of-care test, and they did test positive. And Northwell sent the results sent the individual to a lab, and that person did test positive. Again, a traveler from South Africa who arrived here and is a Suffolk County resident, a 67-year-old woman. Our second case is a Queens-based. The vaccination status is unknown to know whether or not this person had been vaccinated or not. Third case, similar situation. No other further personal details, but the vaccination status is unknown, Queens-based. And another case is from Brooklyn, unknown vaccination status. And we just received word of another suspected traveler case here in the city that was identified in the city, in one of the 5 boroughs. So we knew this was coming, Mayor. We talked about this. You and I have been in communication already. No cause for alarm. We just want to make sure that the public is aware of information when we receive it. We don't have more information at this time, but we suspect there'll be more cases emerging. And the best thing that everyone can do is realize we're not defenseless against this variant at all. That vaccine, we know, is going to ensure that there's less severe symptoms. The booster is something I would highly recommend. If you're not vaccinated, get vaccinated. If you have vaccinations, both series, get the 3rd dose, which is your booster. Ensure that our children are masked up, as well as making sure that they get their vaccinations, of anyone above 5 years old. And also recommend that people continue to wear their masks indoors, and when you can avoid large gatherings at this time. This is not a cause for major alarm. I need to say that, because we do not have enough information. We're not having shutdowns. We're not changing our protocols. We are continuing where we are, but making sure that we work in concert together and encourage people to get tested often, get the vaccination, and that, again, is our best defense. Again, Mayor, I thank you for the continued relationship that we've had since the beginning of my term. Short time, but a lot's been happening, and I appreciate your leadership as we work through these issues together.
Thank you so much, Governor, and thank you for, there's been tremendous communication. You and I directly, but also your team and my team. I want to thank you for that. A very cooperative, collegial atmosphere, a lot of unity of purpose. And I want to say that to all New Yorkers. We are working together to protect you. We have a new situation, but we also know there's a lot of information we do not yet have about Omicron. We know we now have cases here in New York City. We have to assume that means there's community spread. We have to assume that means we're going to see a lot more cases. But we also have tremendous tools, as the governor said. We have a massive vaccination apparatus, and that is by far our best capacity to protect everyone against this variant or any other form of COVID. So the message today is, let's do the thing we know works with COVID. Let's get vaccinated. To all the parents out there of the youngest New Yorkers who have not yet gotten your kids vaccinated, the 5 to 11-year-olds, we need you to get your kids vaccinated right away. To everyone who qualifies for a booster and has not yet gotten it, we need you to do that to protect yourself and your family and everyone in this city. We know vaccination works. It limits the impact. We know this. It limits the impact of COVID. It helps reduce the spread of COVID. We need that more than ever. We are going to keep the public informed. The governor's made a commitment. I make the same commitment to transparency. We'll be constantly updating the public, but as the governor said, right now, the good news is there's a very strong healthcare team for the city and the state working to protect you, and that will be every single hour of every single day. As for what we learned about this conference at the Javits Center and these additional cases, our test and trace team is out there immediately. working with each individual who was affected to figure out who else they came in contact with. That contact tracing is absolutely crucial. We have the strongest test and trace team in America. Thousands of extraordinary committed individuals out there protecting you. They're going to make sure we identify who needs any support, anything in the way of medical support, quarantining, etc. Also, we're going to use every tool at our disposal. Earlier in the week, we announced a vaccine mandate for child care employees, about 102,000 child care employees. Earlier today, a vaccine mandate for employees of non-public schools. That's about 56,000 additional employees. Both of those go into effect December 20. There will be more new initiatives coming to protect people. The bottom line is we're going to use every tool at our disposal. Our healthcare team and Commissioner Dave Choksi is here with us for answering of questions. Everyone is committed to protecting all New Yorkers, and city and state working together in unity to get this done. With that, we'll take some questions. Stating the obvious, this is an urgent moment, on topic only. We welcome questions now from the media.
We'll now begin our Q&A. As a reminder, we're also joined by Health Commissioner Dr. Dave Choksi. The first question today goes to Emma Fitzsimmons from the New York Times.
Hi, good evening. So can you tell us all 5 cases here are believed to be mild, and only in the first case do we know that the person received at least 1 dose of the vaccine?
Yes, we only know.
And then Dr. Choksi, go ahead.
Yes, with respect to the information we just received from the labs, which is literally what happened within the last hour, we only know that 1 person has been vaccinated for sure, and that is the individual from Suffolk County. So that status is not determined. We expect to know it soon, and the symptoms were very mild. And again, we don't have a lot of cases to compare this to, but the individual from Minnesota, the first case that we spoke about today, again, mild symptoms, they recovered at home, and that is why we have to realize that this is actually the 5th variant. I thought it was the 4th, but we added up, it's the 5th variant. The Delta one that is still pervasive. We've had over 7,000 cases over the 7-day average, 5,300 cases statewide just yesterday from the Delta alone, and we don't know whether this is going to exceed that or replace the Delta variant as the #1 cause of people contracting COVID. So more information to follow, but we don't know the vaccination status of anyone other than the first one.
As I turn to Dr. Choksi, just emphasizing the governor's point, we do have a new challenge, but we have a much bigger current challenge with the Delta variant and driving a lot of real profound impact on families all over the city, state, and nation. So I just want to emphasize to everyone, job 1 is still dealing with the Delta variant. Dr. Choksi, anything to add on the cases so far?
Just briefly, sir, the governor and the mayor are exactly right. With those 5 cases, we are still gathering all of the details. We know that 1 of the 5, as the governor said, is vaccinated. It's very possible that others will also be vaccinated, but it gives us a chance to reinforce it's so important. If you or your child are not vaccinated yet, get vaccinated. If you are and you're an adult, get your booster dose.
Emma, do you have a follow-up?
You've been listening to Dr. Choksi and New York Mayor de Blasio and Governor Hochul with some pretty big news. 5 cases at least of this new Omicron virus and the variant. 5 cases. We know for sure 1 person in Suffolk County had the vaccine. They don't know about the other people. 2 in Queens, 1 in Brooklyn, 1 in 1 place of the 5 boroughs. They were not specific. So 5 cases so far. More are expected to come on their way. The cases have been mild. That's the good news. The big push now, get vaccinated, get the boosters. That was the message from both the governor and the New York City mayor. And we'll be right back.